Hi there. My name is Dr. Punith Kempegowda. I am an assistant professor of endocrinology, diabetes, and general medicine at the Institute of Applied Health Research in the University of Birmingham, UK. I'm also a consultant in endocrinology and diabetes and acute medicine at the Queen Elizabeth Hospital Birmingham in the UK. At the ENDO 2023, I will be presenting our work of a systematic review and meta-analysis on body image concerns in women and individuals with polycystic ovary syndrome. Polycystic ovary syndrome is the most common endocrine condition affecting women worldwide. It's as common as 10 to 15% of women have this. What was previously thought to be a benign condition affecting a small proportion of women in their reproductive age, it's changed now. It affects women of all ages, all ethnicities, and everywhere in the world. Now, body image concerns is an area where one feels uncomfortable with how they look and how they feel. Someone might wonder, why worry about body image concerns? When people have body image concerns, it leads to having a low self-esteem. And when you have low self-esteem, that can lead to depression, anxiety, and eventually make you a not so productive member of the society. Several studies have also shown that body image concerns can lead to eating disorders such as anorexia and bulimia, which can be life-threatening. Several studies in the past have shown that there is a link between PCOS and body image concerns, but what exactly is the link? We don't know. How big is the problem? We didn't know till now. So to answer this, we started off with a study where we looked at everything that's published about PCOS and body image concerns together, be it a randomized study or a cluster study or any kind of study. We put them all together into one place and studied them for evidence. The second objective of our work was whatever evidence we find, we wanted to share it with the International PCOS Guidelines Group, who are currently reviewing the guidelines and revising it for 2023. So what we did was we looked at all the major scientific databases, be it PubMed, Central, Medline, all of them, for any study that's published for polycystic ovary syndrome and body image concerns, where they have specifically used a validated questionnaire. And that's important, and I'll come back to that later on in the talk. What we found was there was about 6,221 articles that we found on our initial search. After meticulously looking through all of them, we narrowed it down to 9 articles which were relevant to our work. That's going from 6,221 articles to 9, which were reviewed by 2 independent researchers, and if there was any conflict between them, a third independent researcher to resolve the conflict. When we looked at it, we found some studies had used the same questionnaires and some of them have their own questionnaire. What we did was we combined the studies where they used the same questionnaire together, and we did what we call as a meta-analysis. We used their data, combined them together to find an additional analysis, which is a combination of 2. The 2 most commonly used questionnaire was the MBSRQ survey and the BESAA survey. I'm not going to go in detail about that, but in simplest terms, the MBSRQ has 69 questions, which breaks down into 5 subscales, and BESAA has 3 subscales, which has 23 questions. What we found that when we combined the results in MBSRQ questionnaire, women with PCOS fared worse in all the subscales, showing that there is a concern about body image in women with PCOS when compared to their colleagues who are healthy and do not have PCOS. With BISA, we found a little bit of a mixed picture. With BESAA, there was still a significant difference about weight perception, but how they felt and how they attributed, there was no significant difference. And probably the main reason being it was only 2 studies who've used it, and there was a smaller number of people that were involved in the study. Why is this important? So this is the first systematic search on body image concerns in PCOS. And we feel that by identifying or diagnosing body image concerns, we will be addressing patient concerns. And that is important because we clinicians have our own thoughts of what we need to help out for women with PCOS to prevent long-term risk, but it is also important to talk to the person sitting in front of you right now. What is their concern? And there's also a generational shift when women with PCOS used to go and say, oh, I'm worried that I can't have a kid, to now saying that I'm worried that I don't feel well about myself. So we need to start addressing that. So when we shared these findings with the international PCOS guidelines, they had discussion and said we should probably approach this as an individual case by case, because it will mean that the length of consultation might increase if we spend time with body image concerns. But this is where questionnaires come into play. A validated questionnaire, a person can complete that before they come into the consultation, so that thereby we can minimize the amount of time spent. And if they're not scoring on, if they're not scoring high on the questionnaire, we don't need to address that. If they are scoring high, then it can be picked up as a topic to discuss. As I mentioned, there are a couple of limitations, one being fewer number of studies and lower numbers of people involved in the study, and we need to address this in the future. But long story short, at the moment, there is evidence to say that body image concerns is quite significantly high in women and individuals with PCOS, and this is something we need to address as soon as possible. We are planning some future work on this to understand how exactly social media plays into play, society influences body image, and also how healthcare professionals across the world are addressing PCOS and body image concerns. And hopefully, we'll be able to share these findings in the near future. Thank you.